The London Bridge Sports Medicine Podcast. Medical news, health, fitness with Dr. AJ Seth.
Hi there, today we talk to Deirdre, who's a pelvic health expert, about the topic of coccydynia. This is a really common cause for lower back pain, and we discuss how it presents and what we can do to treat it. If you feel any of the issues discussed are relevant to you, please feel free to get in touch to see how we can help. Hope you enjoy listening. Hi Deirdre.
Hello.
Thanks for joining us on Ask the Expert.
Not a problem. Good to be here.
So today we're going to be discussing about men and women's health.
Yeah.
And this is a topic that I don't think many patients know about. I certainly didn't know much about this when I was sort of starting at medical school and going through the training and stuff.
Mm-hmm.
So just give us a bit of an overview about yourself really, men's and women's health and how you got into it.
Yeah. So similar, I think it's not very well taught in medical school, physiotherapy school. So it was something that we had one lecture on at uni and then never heard of again for the rest of that course. So yeah, I graduated from university in 2007.
Okay.
Just went straight into kind of normal physiotherapy rotations, which kind of standard things you hear about, like musculoskeletal, like ward-based stuff. And then where I was working, there was a lady there who was really passionate about women's and men's health. So just very excited about her job, but was really passionate about how much she could help people's lives.
Yeah.
And just really piqued my interest in what is this thing that kind of she does, and what is it that she does for the patients. So just did a bit of shadowing with her, spent some time kind of watching her clinics, and then decided to kind of segue into that on like a part-time basis. And then just kind of found that it was really interesting, really enjoyed it, and then just did more and more and more of that, and then become full-time after about a year of working with her. So that was 10 years ago.
Okay, wow.
Which is a long time.
Yeah.
And yeah, what it is, so it's looking at kind of, I suppose we call it pelvic health now because we realize it was used to predominantly be women's health, was the kind of main treatment, I suppose, profile of patient that we used to see.
Yeah.
Now we're seeing a lot more men come into kind of the service and into the clinics.
Sure. So
we've kind of called it pelvic health because we want to be inclusive for everyone.
Yeah, definitely.
And yeah, it's looking at kind of different symptoms that they might have. So with things like bladder, bowel, pain around the pelvis, sexual pain, erectile dysfunction. So a whole host of things that we can help assess and treat, and hopefully improve those symptoms for those kind of patient group.
Yeah. Oh, brilliant. And it sounds quite niche, doesn't it? So how many? I mean, most people wouldn't put women's health, men's health, and pelvic health in line with physiotherapy. So what is the therapy side of it?
So the therapy side is looking at mainly the pelvic floor. So the muscle group that kind of sits within the pelvis itself. Okay. And looking at how it functions. So is it weak? Is it overactive? Does it need some strengthening work? Does it need some soft tissue release? Yeah. And then all of the kind of structures that sit around that. So a lot of the external muscles, some of the neural tissues that we see. And then I suppose there is a bit of psychology around that as well. So there's always a little bit of psychology work. Not that we're trained that well in psychology, but that, you're just helping people with their anxiety necessarily around that. Yeah. But also looking at things like bladder function. So kind of how the bladder responds, if they've got any issues with that, and kind of training methods to help with that too. So, and
it's a very delicate area, isn't it? So are most people who come in quite anxious about their symptoms and how they can resolve, and what's your usual sort of patient cohort you see?
Predominant patient cohort, I would say, tend to be postnatal women would be the biggest group that I see. Yeah. So definitely quite a lot of anxiety already in that patient group, just with having a newborn baby, maybe having some symptoms with bladder control issues, maybe having some pain with kind of returning to intercourse, sleep deprived.
Definitely,
So definitely a lot of kind of anxiety around those issues. And because, again, like you say, really delicate issue, so not a lot of discussion maybe among friends or family. They feel quite isolated with their symptoms. And I suppose just trying to figure out how they are going to improve, when they're going to improve, how long it's going to take for those symptoms to resolve is always the biggest questions that they've got.
Because when people think of pelvic floor exercises, they automatically think of pregnancy, don't they?
Yeah, always.
That they seem to go hand in hand at the moment.
Yeah.
So you talk to any sort of male or female at the moment, they will always put those two sort of symptoms hand in hand.
Yeah.
And that still is perhaps the biggest patient cohort you see.
Yeah.
What other signs of symptoms do people normally present with? You mentioned a few, like bladder dysfunction, but you mentioned things like problems with intercourse and problems in the bedroom. How does that manifest in terms of pelvic health?
Yeah, so that manifests mainly in terms of pelvic pain. So pain with intercourse tends to be the biggest thing that we'll see.
Yeah.
And that can be for men and women. So we see lots of women that have pain with penetration, pain with even touch sometimes in that area.
Wow, okay.
And then men, they sometimes will have pain with ejaculation or pain with erections. So kind of discomfort or kind of burning sensations around the kind of testicles or kind of the perineal area. So pain tends to be the biggest, I suppose, presenting symptom for those kind of sexual dysfunction patients.
And those are quite alarming symptoms, right? If you're a young male and you're getting pain in and around, your genitalia and sensitive areas, I guess, one, you're going to be alarmed.
Yeah.
And secondly, the first thing you wouldn't think to do is get expert advice with regards to pelvic health.
No.
You might be inclined to think it's more of a medical issue, or there's something medical going on.
Yeah, definitely. And we would always say that you should definitely get that checked, those symptoms checked medically first.
Yeah.
The I suppose the trouble with men's health physiotherapy is that it's not very well known about. So those patients tend to stay in the medical system for quite a long time, which can be quite hard to treat then whenever they do eventually come to see a physiotherapist, because there may be a few years down the line from when those symptoms started.
And by that you mean doctors have been looking for other causes to do with the structural issues, such as problems with, as you mentioned, problems with ejaculation, maybe something to do with the testicles or sperm production and that sort of stuff, but not necessarily thinking about the pelvic health and pelvic muscular structures.
Yeah, definitely. So they get lots of investigations for things like infections or like you say, kind of structural things that might be causing symptoms. And sometimes it's that the doctors maybe haven't thought about those things. Sometimes it's that they may be a bit stuck of where to send the patient because there's not that many men's health.
Well, and as we were saying, I don't think many doctors or even GPs are fully aware of what's available from a men's health point of view. So I think if someone came into a GP clinic, for example, presenting with those types of symptoms, the first place you might want to send them is to a urologist.
Yeah.
So a urologist is a doctor who deals with kidneys and bladders and the waterworks essentially. And although that's great from a medical point of view, it might not be the best actually from a therapy point of view.
No. Yeah, definitely.
So, okay, so that's great. So we've just touched on a few of the signs and symptoms of sort of pelvic floor health. Why is it important? Why should people, why should it be at the forefront of people's minds?
We know that from lots of the kind of health questionnaires that they do with patient groups, especially the patient groups that have pelvic health symptoms, is that actually their quality of life is massively affected by their symptoms. They've done studies on people that have prolapse symptoms, so women that have had prolapse symptoms, which is where some of the pelvic organs have maybe moved out of position, due to either muscle weakness or connective tissue issues either post birth or just with age. And they find that quality of life for those women was significantly affected, and worse even than people that are living with cancers or kind of other like diabetes, other medical health conditions. So the quality of life was.
So we're talking about incontinence here to some degree, aren't we? Women wetting themselves, or
not always with prolapse symptoms. So prolapse symptoms can give incontinence, but you can have bowel issues with those. You can just have vaginal symptoms. But they can be quite scary symptoms, I think. And I think that's a big thing with any pelvic health issue. The symptoms can be really quite scary if you're not sure what they are or what's causing them. So people tend to do things like maybe not, especially like with incontinence, they maybe don't leave the house as much as they used to because they're afraid of
having an accident
themselves or having an accident in public.
And this is not just older people, is it? This can happen to very young people as well.
So it obviously can happen to children. You see children that wet the bed, children that have giggle incontinence, but it can carry on into teenage years and then even into kind of early 20s. I think the youngest patient I seen was in her like early 20s, 20, 21.
Okay, wow.
And then the oldest patient I've ever seen has been like 89, I think.
So. And so, for example, that 21-year-old, is it quite an easy fix? Is it something that actually you work hard and train? So people might be used to exercising different other parts of their body, but if they were to work on their pelvic floor and exercise in the right way, is it fixable? For
the majority of patients, yes.
Okay.
So for more than 80% of patients, we can help to really improve their symptoms.
Brilliant.
Obviously not for everybody, but as a first port of call, we'd be suggesting that actually pelvic floor should be looked at, whether or not that's, like we said, it's to be strengthened or to be down trained or kind of helping it to release or relax. Definitely. Pelvic floor.
So I'm a young person, I've got signs and symptoms down below, I've been to see my GP and I've been checked out for various things. I've had blood tests, I've even had an STI check, or sexually transmitted infection. So all those boxes are ticked off. But I'm still having these symptoms and I've got no answers. What would be the next step for me? What could I potentially do?
So either ask your GP for a referral to a pelvic floor therapist or pelvic health therapist. That would probably be the first thing that I would suggest that you do. And those services are available on the NHS. They're also available privately. And if you've got private health insurance, then definitely, the waiting lists are always going to be shorter private healthcare. There's lots of resources online. So kind of, looking at things like kind of pelvic floor websites or pelvic health websites. Got the prostate cancer website for men with kind of prostate issues, but there's lots of pelvic floor advice on there for men as well.
Brilliant.
So definitely get checked is the kind of take home message.
And that's a great start, isn't it? I think if we're giving patients confidence to go and actually get these symptoms investigated, which they may have had in their back of their mind for quite a while, then that's always a good first step. Yeah,
definitely. And then with your physio, you come up with a treatment plan as to kind of what is going to be the most suitable for you as a patient. And that might be a referral onwards potentially if need be, or if they're concerned about anything. Or it might be that you stick with the physio and kind of move, hopefully progress and improve.
Brilliant. Thank you so much, Deirdre. That's a great insight to pelvic floor health. And I think in the other podcasts we're going to touch on various different elements and certain conditions which people may be suffering with. But for today, thank you very much.
That's okay. Thank you for having me.
See you soon.
See you soon.
Thank you for listening to LBSM's Ask the Expert series. We really hope you enjoyed listening. If any of the topics discussed are relevant to you or you want to find out more, please get in touch by phone, email, social media, or visit our website. Thanks again and see you soon.